Well, welcome everyone. It's great to welcome you to this special episode of Better Story. And it's a great privilege this afternoon to interview my guest, Dr. Nir Samuel. Nir, welcome.
Thank you. Thank you for having us.
So, Nir, I'm very excited to have you here to talk this afternoon about your work and the collaboration in the field of medicine between Australia and Israel. So just to start off with, can you give us a brief outline of the kind of work you do and how you ended up in that work?
Sure. So I'm a physician. I train in pediatrics, trauma and emergency medicine. I'm currently working in Schneider Children's, which is the largest children's hospital in Israel. Treats kids from all over Israel and all over the region, actually. And I was tasked with building the first trauma service for trauma in ways of severe injury for children. And for that purpose, I was fortunate to come to Australia and train in the Alfred in Melbourne, the largest trauma service in Australia, and spent over a year, almost a year and a half in Australia, came back to Israel, started building up the trauma service, and then we had an eventful year there. I don't know if you've heard of it, but...
Yeah, I think I haven't. Some of our listeners might have heard of the eventful year, but let's back up a little. What got you into medicine in the first place?
Oh, that's interesting. So I was born and raised in Jerusalem, and I liked hiking around with friends. They had a different approach to risk taking than I did. So I figured, well, someone has to learn first aid. So I went to learn first aid, and I started volunteering in MADA, which is the Israeli EMS service, as a high school volunteer. And that was my first foray into trauma and injury and sickness. And then come my mentor military service. I served as a medic, combat medic, and then a medical officer. Discharge, went to med school. In med school, surprisingly, I found that I like working with kids. So I pivoted to pediatrics, but the trauma and injury bug was still there. So emergency medicine and trauma. And now I do all of those.
Wow.
Trying. Yeah, absolutely. So children, to cut a long story short, children get injured differently. They need to be treated differently. And like in any other field in medicine, when it comes to children, it's usually a different approach. And when children are treated by people, providers, teams that are specialized in children, the outcomes are actually better. They do better physically, they do better mentally. And I'm lucky to work in a place that's its paradigm, that's the dictum. So children are different and they're treated differently. So
the Schneider Hospital is where you work?
Yes.
And whereabouts in Israel is that?
So Schneider is a Petah Tikva. I hope I'm not being taped, but it's a suburb of Tel Aviv, and it's the claim to fame of Petah Tikva is that it's the most boring town in Israel. But it is a rather big hospital, an adult hospital called Belinson, and we're a standalone hospital named Schneider. So we're the largest standalone children's in the Middle East. And we take kids from all over Israel and all over the Middle East and even Europe, a national referral center for most things. And now we're going to have a trauma service.
So up until now, there was no dedicated trauma service. If a kid got injured, if they experienced some kind of trauma, how would they just treated in an adult
so interesting
A&E ward?
That's interesting. So in Israel and in most places around the world, actually, injured kids are either treated by people who specialize in trauma in adults that also treat kids, or people like my peers who are very highly specialized in pediatrics and kids, but also do trauma. So, and severe injury in the Western world, in Australia and Israel, Europe, kills more kids than any other disease combined, including cancer. So the most lethal disease in childhood needs dedicated providers. That's the train of thought, and that's what you're trying to build. So it's not that kids haven't been treated until now. Of course, they've been treated, but we think that with integrated, focused, dedicated care, they can actually do much better. And that's what we're trying to do.
And is there data to support that?
Yes. So pretty much for every field in medicine, from regular disease through cancer, through trauma, we see that when an institution, when a team is geared and specializes in children, they survive better, they have less handicap, they stay in the hospital for a shorter period of time. And also the emotional burden on the patient, on the kid and their families is much lower. So yeah, so it's very well supported actually.
That's amazing. That's wonderful. Now, you mentioned something that the listeners might not have picked up. You said you treat patients from all around Israel and around the region and even Europe. So I'm assuming there's a bit of a narrative going around in Australia and the Western world that Israel is an apartheid society, right? Now, I studied medicine back in the day in South Africa, and a long time ago in apartheid South Africa, you had apartheid medicine where you had whites-only wards and black wards and colored wards and Indian wards and different levels of care for all. Is that what happens in an Israeli hospital? Tell me a bit about your experience of practicing medicine in the Schneider. How does it work? Yeah.
So this is actually very frustrating for myself and all my colleagues and actually other Israelis. So apartheid is a very emotionally triggered word, and rightly so, because apartheid, I think we can all agree, was a devastating concept for society, for humanity. And so when people use that word with reference to Israel, I really try to give them the benefit of the doubt that either they don't understand apartheid, they don't understand Israel, or they don't understand both, and that they're not doing this with malice. But of course, and not only in Schneider, everybody gets treated. Everybody gets treated equally. Everybody gets treated by everybody. And that doesn't only go for the patients, that goes for the teams, doctors, nurses. They can be Jewish Israelis, they can be Arab Israelis, they can be Muslim Arab Israelis, they can be Christian Arab Israelis, they can be Druze, they can be Cherkess, and then other ethnic groups that most Westerners haven't even heard about. So it's really frustrating, especially in a time like this, with Israeli society going what it's going through, and that we have to somehow, instead of focusing on our grief, be apologetic to something that we've always done, and we actually don't really give it a second thought. So it's a fact of life. It's like asking me, do I treat women and men similarly or differently? It's just something that we do.
Yeah. It always struck me that, when you end up in hospital, you all bleed the same. When you cut someone open, you're the same. Skin color, culture, language, religion, doesn't really matter. We're all the same. And with kids, it's all the same. So you treat kids from around the region. I mean, there'll be kids coming in from other parts of the Middle East because there's no trauma centers for kids.
Not only for trauma, for cancer, for all different diseases. So Israel has a very well-evolved medical system, and that often goes below the radar for different reasons, either that the media doesn't want to publish it or the families itself do not want to publish this, and we respect that. So for example, and I've written about this, so during the civil war in Syria that is now just flared up, Israel was not a direct part of that conflict. Israel took in thousands of Syrians, adult and children, and treated them, not only injured, also sick. That was taken care of by the Israeli medical system. People coming in from the territories, coming in from Gaza, this still happens. Leadership from all around the Middle East bring patients to Israel, and we're happy to accommodate. The Israeli medical system, like any public system, is overburdened.
Is it? Yeah.
Still, that's a burden we take because we believe that medicine is a bridge between societies, between communities. And maybe we can be called naive at this point in time, but we still believe in that.
Well, because it's about bringing life. Exactly. And that matters a lot, right? In a world that's so full of, particularly the last 18 months, hatred and fighting and death and conflict, to be able to do something positive matters a lot.
To be honest, it's never been a rose garden in the Middle East, as I'm sure you know.
Nice.
Yes. But yeah, the last year and a half has been extremely difficult. That's true.
Has that put additional strains on the hospital system in Israel, and particularly the trauma centers? I'm imagining it's been...
Yes. So I advocate for trauma all the time, but yes, the last year and a half we've been having a very high number of casualties. The system is stretched. Providers also, like myself, sometimes have to go and treat pre-hospital, outside the hospital patients, civilians, soldiers, whatnot, and that puts an extreme burden. And the burden is not behind us, so we're still in this. The burden is going to turn into rehab. The burden is going to turn into a mental burden of mental health for patients, for providers also. So yeah, we have a long road ahead of us.
Well, one of the things I read recently was the survivability of trauma in this war has been better than in any other conflict, because people like yourselves, the trauma treatment has become so much better than in previous wars. It's been wonderful. Lots of lives have been saved. But what that does, as you say, is push the burden onto long periods of rehab and enormous numbers of people with recovering from very traumatic injuries that in the past might have taken their lives. Is that fair to say?
True. Yeah. So what we've seen the severity of injury go up, but luckily we've also seen survival go up, and that happened for a number of reasons. First, on the personal provider levels, we met this challenge that there were a lot of failures, a lot of unfortunate things that happened during this year or more, but the medical system was highly trained and highly adapted to this. And so providers, each one in separate, were very highly trained. The system worked and works very well together. And that's why we managed to bring the death toll down to minimum. Yeah. That often came as a price, as you suggested, on higher rates of handicap, because people who would have died in previous years now survive, but they do have significant medical and psychological needs that need to be attended to. And that falls as a burden to the system.
Yeah. So here's a thought I had, and maybe our listeners might be having that as well. Surely, what does Australia have to learn from Israel? Or put it another way, what does Israel have to learn from Australia in the field of trauma? I mean, aren't you guys like the best in the world of trauma because you live in the Middle East? There's so much of it. Surely here in Australia, I mean, we don't have much trauma, do we? I mean, what's because you came and studied here, you did a fellowship
Absolutely.
Here with Aussie Med. It was an Aussie Med Lowy fellowship.
Exactly so.
So tell us a little bit about that and what you learned here and why that was so significant for the Israeli context.
So first, Israelis like to consider themselves the best in the world, even though
at everything.
Sometimes we are, sometimes we aren't. But yeah, we tend to think that very highly of ourselves. So, but to be serious, so both the Australian and the Israeli systems are very highly evolved medical systems. They're both excellent systems, and in terms of coming across and learning, whether it's from Australia to Israel, from Israel to Australia, that's actually a feature, not a bug. Because if there was a really big gap between the systems, you couldn't leverage learning from one system to the other. But because they're on par, you actually can. And so for me, I was fortunate to be trained in excellent institutions and have excellent mentors. And I came to Australia and met actually their counterparts in the Alfred in Melbourne. Amazing clinicians, very benevolent, very instructive, with a lot of immersive learning, had very different approaches. And that's what you learn from. And that's what I learned in Australia. That's what Australians can learn in Israel. So it's that interconnection, the collaboration, and that brings up new ideas. Same in medicine, same in science. That's what you're trying to bring forward. And I must say, in the short retrospect of this last year and a half, so I came to Australia to train for just over a year. There were amazing fellows before me. They're having and will have amazing fellows after me. And I expected this to be a rewarding episode. And it was a very rewarding episode, but it became much more than that. So post October 7th, my Australian team reached out, checked in. How am I doing? How is my family doing? Do I need help? But it wasn't not only on the personal level. It was between communities. So they asked, can we come train? Can we come treat? And that is unique. It's unfortunately unique, but I have friends in Israel that had very different experiences with their international teams, with the places where they train. And that really, in my view, gives a lot of credit. I told Professor Jill in the Alfred, for me, this goes way beyond the professional, way beyond the medical. And we speak of Australia and Israel collaborating. I think it's a misnomer. It's Australians and Israelis collaborating. And I think it's based on humanity. I think it's based on shared values. And yes, it's built also on a special field of medicine and competence and skill. But the basis for it is humanistic. That's the way I see it.
Yeah, I love that it's Australians and Israelis rather than some two political entities. Abstract. Yeah. It's just people doing medicine together, making the world a better place, one sick person at a time, which is wonderful. So this program, we're looking to bring, one of the things we're looking to do, or Aussie Med's looking to do, is bring a group of physicians from Australia to Israel to do training with you in Schneider to do what? What exactly do you think these guys are going to be doing?
That's right. So what I found out in my Australian colleagues is that not only are there excellent physicians, they're also excellent teachers, and that doesn't always come together. So lucky for them, it does. Yeah. And I was fortunate to receive some training, and I work with them and give that training myself. Training that's high fidelity, high end, very advanced, and now available in Australia, obviously, but also in the United States and Europe. And so a few Israeli clinicians have come over to Europe to train in Europe with the Australian team, but we want to make this accessible. There's a big need in Israel to widen the space for providers from different fields: surgery, emergency medicine, intensive care, anesthesia. And we want to bring that to Israel, and we're fortunate to have that benevolence on the Australian side, and the Australian faculty is willing to come. And not only that, we're aiming to have a delegation of senior trauma leaders, Ministry of Health, Ministry of Defense, to really come and have that learning. I learned a lot. I'm sure my colleagues can learn a lot from the Australian system. I also know my Israeli colleagues very well. I know their inputs, I know their insights, I know what they've been through, and I know the data that's been collected in Israel. So I think it's cliche, but it's really a win-win for both sides.
Yeah.
That's how I look at it.
And this is happening in June this year.
Yes,
that's the plan.
Yes, the end of June. That's right.
Okay, that's fantastic. So, when you look at the future of the health system in Israel, what do you hope for it? When you think about your contribution and where this system could go, what are you hopeful for?
So I think when we think of building something, we're biased towards the physical. We're biased towards a building. And Israel, I don't know, so luckily it's relatively, when I came to Israel and told people here, listen, Israel is a small country. And it's told me, oh yeah, like Victoria. I said, no, not like Victoria. It's a really tiny country. So we can always build more physical assets, but Israel is actually pretty much resource dense. But there's something you can always improve on, and that's your training, that's your competency, and that's your collaborations. And so what we're aiming to get is, of course, a course in training providers and training them how to teach others, but really get that collaboration, what I found so rewarding in Australia, going for multiple people. And that would translate, I believe, to science, that would translate obviously to medicine, but it would also translate, I think, to society. And that's what we're aiming for.
It always seems to me that Israel is this beacon of hope, of light, of Western civilization, of Western medicine, of Western science, planted in the Middle East to really shine its light and be a blessing to the region, if the region wants to be blessed in that way, accept the blessing. But in terms of medicine, to have best in world medical care available for patients from around the region where they aren't resource dense, where they don't have the human capacity. I mean, it's investing, God willing, in actually building bridges across the region, which will be so wonderful. So I don't know, Nir, if you follow much about what happens in the rest of the world. Obviously, you spent a year here in Israel. I mean, you're pretty busy in Israel. What do you think about the levels of anti-Semitism in Australia? I mean, presumably you saw the footage of these two nurses at Bankstown Hospital threatening to kill Israelis and making, really terrible accusations. Mm-hmm. I mean, I had a few thoughts. One, why aren't they working? Like, what nurse has time in the middle of the night to sit on, social media and chat with random strangers? So that their colleagues probably aren't that happy. And the nurses union, who want more money and less work, is probably not that happy with them. But I thought, what a terrible violation of everything there is to do with healthcare, this politicization of healthcare. So what do you think about that, about anti-Semitism in Australia?
So I heard of that incident, and I was shocked. Like, I think everybody that heard it. It's not what I know Australia is like. It's definitely not what Israel is like. I can say that in Israel, if someone would utter something like this, he'd be out of the job in 5 to 6 seconds, pretty much. Regardless of his original ethnic group or what ethnic group he said that about, it's just hate speech. Yeah. And in the medical practice, it's a safety issue. no one would, I can't trust a colleague that treats different patients differently. As a provider, of course, as a patient or as a patient's family. So, and when we're talking about anti-Semitism, I think the world has made big progress in what he accepts or does not accept in terms of reference or approach to minority groups, to underprivileged groups, whether it's on ethnic basis or gender or sexual orientation. Some things that were sometimes accepted are now not accepted, not in action, not in words. And for whatever reason, when it comes to Jews or Israelis, then there are exceptions to that rule. And there shouldn't be exceptions to that rule. And I must say, as an Israeli, I was living in a bubble without anti-Semitism. And my perception of anti-Semitism was that it's there, but it's not mainstream. It's on the fringes of the right. It's on the fringes of the left. And that, to be honest, some of the things we as Israelis call anti-Semitism was criticism of our government, which you can agree with or not, but it's not standard anti-Semitism. And one of the reasons that October 7th was mentally, psychologically devastating for myself and others is that I found out I was completely wrong. So it turns out that it really is much more mainstream, and it's just under the surface, and it's entrenched within groups that I consider my international peers in terms of education, in terms of shared values. And that's really mind-blowing. And that comes as a double hit. So Israeli society was hit. We had babies murdered, women raped, people murdered, civilians, whole communities were raided and desecrated and destroyed. And instead of grieving, we had to fend back allegations, accusations, support for those who did that. And that's mind-blowing. I don't have really a good answer to this. It's so regretful. I hope that in retrospect, people will regret what they've done. I'm not sure that will be the case. I am pretty sure it won't have that same effect as standing on the right side of history right now. And, there are a lot of talk about moral integrity. So moral integrity can be in words. You can be anti-Semitic. You can be against anti-Semitism. But coming back to my Australian team, when they say, we want to come train and treat, that's moral integrity with actions. And that means a hell of a lot more, in my view.
Yeah. I mean, I can't imagine what it's like to have gone through October 7 as an Israeli and then wake up and find within 2 days there are people siding on the side of Hamas and the rapists and the terrorists, and then accusing you, not Israelis, of being evil and perpetrating evil. That must be so damaging. I mean,
yes, yeah. There's a significant moral injury with that, and I'll throw in another word for the discussion: colonialism. So that's a word that gets thrown out quite a lot, and. When you come to Australia, and every talk, every presentation starts with acknowledging the original owners or ethnicities and whatnot. For an outsider, that may seem odd, but in Israel, ethnically, Muslims, Christians have been in Israel for centuries. They, of course, have their rightful place, citizenship, whatnot. Jews have been there for millennia, so you cannot say we are not the indigenous. Yeah, I won't say even owners, but the indigenous inhabitants of the land. Okay, and calling Israeli Jews colonialists is just factually wrong. It's inaccurate. Some know this, some do this explicitly, but that's just wrong. What is colonialist, in my view, is for people who do not live in the Middle East, not only to have views, but to have uneducated, ignorant views, and then try to force them upon the populations that live in the Middle East. And by that, I don't only mean Jewish Israelis. I mean that things that would be unacceptable in any Western country are apparently culturally appropriate when it comes to Middle Easterners. And, I've been following this Iranian lawyer. She works from London, called Eli Kalebon. And she talks about this quite a lot, that Westerners still think that they can force their views upon populations that are weaker, that are Middle Eastern, because that's their view of the Orient. And that's, for me, that's the new colonialism. And when it mixes with anti-Semitism, often that's a perfect storm.
It's I've sometimes heard it described in other contexts as the racism of low expectations.
Mm-hmm.
So cultural practices that we in the West would think are abhorrent, well, it's all relative and it's justified. What do you make of the fact that so many in the medical establishment have bought into some of the outright lies about Israel and the Middle East? Because medicine, I mean, I see this, that was my background, my family background. I have friends who practice. It's a problem in the health system here. It's a problem in the NHS. It's a problem. So you have in nursing, doctors, all these people here. What has gone wrong that in a field that is supposedly based on facts, you have people living in a counterfactual reality with such arrogance?
Yeah, so when you're talking about 20-year-old college students, they're just starting their way in life. You can make allowances for them, but my expectations for my peers, as I said, so we're held to higher standards. Physicians, judges, men of the cloth, clergy, whether Jewish or Christian or Muslim, we have a role in our societies. We're leaders, whether we like it or not, in our societies. So we have an obligation to basic principles. We have an obligation to values. We don't get to get away with things like people who are less educated or earlier in life, like students. And I know the standards these people know how to uphold, and when they don't, it's by choice. It's not by accident. Mm-hmm. And they should question themselves why they do that. And if we're talking about medical journals, it's not only the person writing the article, it's the editor and the editorial board that approved the article. And I try not to attribute malice. I don't know if you've heard of Hanlon's razor. Yeah. So I try to attribute it to incompetence, but they're not stupid people. So
no. Sometimes you have to be very, very smart to be stupid. I mean, the classic example in my mind was the infamous Lancet Journal article of about a year ago, predicting that there were possibly 186,000 deaths in Gaza at the time. And when you dug into the article, you just went, it's just fanciful projections that provided nothing but propaganda material for people who hate Jews and hate Israel. I mean, I was astounded at the capture of the editorial boards of these medical journals.
Yeah, that's true. That's true. So, I recently read an article published in a high-impact pediatrics journal. It came out of Australia. The author is out of Australia, and it was published as an editorial. So that technically means that the editorial board signed on, the journal signed on to have this. And the title of the article was "No Child is an Enemy." Now, we can all agree on that no child is an enemy. But in that, in medicine, we have errors of omission and errors of commission. So in terms of errors of omission, there was a wide discussion of the suffering of Palestinian children, which, is horrible. Nobody's happy with this. Nobody wants this, obviously. But there was no one mention of the burden, physical, death toll, hostage children in Israel. So just one side of the story. Now, that's not whataboutism. That's just not telling the story. Now, the author of this was published in November. So about almost more than 1 year in. So the context was there. The knowledge was there. Again, a very knowledgeable person wrote that article. He explicitly chose not to mention the fact that that Israeli kids are involved or being hurt. I don't know if you know this, but on October 7th, not many Israeli children were injured. And that's because they mostly died and did not make it to hospital. And I'm not talking about the hostage children. And the hostage children that came back dead. So, all lives matter. And no child is an enemy. We can keep saying those sentences, but we have to put actions around this. And when this is not being said, when my children are not cared for, that reflects an unequal. We talk a lot about equity in medicine, right? So that reflects an unequal, biased view of humanity, and that's not what I expect from my colleagues in Australia or outside Australia.
I mean, listening to that makes me angry. I mean, because I'm expecting an editorial next week from the same person about the death of Syrian children at the hands of the current regime in Syria, and the massacre of Christian and Alawite kids in Syria.
You won't, because inter-Middle Eastern conflicts or inter-African conflicts are considered culturally appropriate.
Yeah, that's right.
So
no Jews, no news.
I'm of course saying this cynically, but no, it actually goes beyond that. Beyond it, anti-Semitism is a component, but it goes. So the societies being hurt in the Middle East are not just the Jewish society. It's also the Muslim society. It's also the Christian society. You know, when I trained in Australia, I had she is still a dear friend, an Australian physician, and she was born in Egypt, and she came to this country as a child, and her husband is a priest, part of the Coptic Church, and their shared experiences as a minority, as a religious minority in another country that's not Israel, was very similar. So it's not only about Israel, and it's not only about Jews. It's about Western people forcing their biased views on Middle Eastern communities, and they're not doing anyone any favors. That's what I think.
Oh, that's fair enough. I mean, Israel's the only country in the Middle East where the Christian community is increasing. They've been ethnically and religiously cleansed from the Middle East.
Thriving, yes.
And so, but somehow that's all. I don't know if you've. This is a question I ask a lot of people, and you may not have the answer to it, or you. So, how many jihadist terror attacks do you think there have been since 9/11 globally, like around the world, say in the last 25 years? If you had to guess, how many?
I'd say a few thousand.
A few thousand. You know how many have been tracked? 44,000.
Oh.
It's extraordinary. This is a clash of civilizations and a battle of good versus evil. And I think what I love about your work and your story, which you've told so calmly, is you and the Israeli medical community are at the absolute pointy end of this fight against evil. Sure. And you're trying to do it while holding on to your own humanity and treating everybody the same, being the very best. And this is why you went into medicine, I started in medicine. That's why you go into medicine, because you love humanity and you want to do your best, irrespective of ethnicity and culture. So I applaud you, and I hope our listeners get a lot out of this and support the program. And I hope there'll be people like the person who wrote that journal article who might come to Israel and actually learn some facts.
Hopefully.
Wouldn't that be a good thing?
Yes. I think when people take their time to have an opinion about the world, about other communities, that's laudable. That's commendable. But they have a duty to be informed. And they have a duty to try at least not to be biased, and to be humble and modest, and not to try to force their views, and to be careful not to fall into an NIMBY, the not in my backyard phenomena. Don't accept for a Jew, a Christian, a Muslim that lives elsewhere in a different region of the world something that we would not accept for your kids or your wife or your... So we all deserve the same circumstances of living, I think. First and foremost, healthcare, of course, but, other things as well.
Well, Nir, thank you so very, very much. I just wish you all the best in your work in Israel. And if you've got this far through the podcast and you're still listening, I'd encourage you to support the work of AussieMed. It's doing fabulous work. Help fund this project to get a bunch of Australians over to Israel to do some training. And if you're a medico listening to this and you would like to travel to Israel to train or treat or learn, then get in touch with AussieMed, get in touch with me. We'd love to make that happen. And I'm sure you'd be very happy to host.
Absolutely.
Humble.
All invited to Schneiders.
All invited to Schneiders. I think we should finish, but one of the things I loved, I've been involved in taking medical teams to Africa and various places. We've worked with a hospital in the eastern part of the DRC for years. Yeah, the gap in capacity in health systems was always a massive problem. So I love the fact that it never dawned on me the fact that Israel and Australia have similarly evolved health systems means that the transfer of skills and knowledge is good. So I've learned something. Actually, I've learned a lot. I'm very inspired. and almost regret giving up medicine.
It's a difficult life choice. It's okay.
It is.
You're benefiting society greatly right now, so I don't think you should have any regret.
No, it's wonderful. And if you want to find out more, go into the show notes. If you want to find out how to support the work of AussieMed, there'll be a link below where you can give generously. Thank you so much.
Thank you, Mark.